Hi, welcome to this week's Nurse Coach Duo. Today we're interviewing Dr. Jennifer Ritchie, a licensed psychologist and the founder of Gateway Behavioral Health Consultants. Dr. Ritchie specializes in psychological assessment and therapy for neurodivergent adults with a focus on ADHD and autism. We wanted to talk to Dr. Ritchie because in midlife, so many women are starting to notice changes in focus, memory, and mood. And for some, the hormonal shifts in midlife can really unmask the ADHD symptoms, and suddenly everything feels harder to manage. So, Dr. Ritchie is going to help us sort through all of that today. But first, let me tell you a little more about her before we get started. Dr. Ritchie is based in St. Louis. She earned her doctorate in clinical psychology in 2015 and brings both her clinical expertise and her lived experience with ADHD and anxiety, which gives her a unique and compassionate perspective. She focuses on evaluating and supporting neurodivergent adults, and she's passionate about helping them feel understood, supported, and empowered in their everyday lives. Dr. Ritchie helps her clients make sense of their experiences, gets them access to the services they need, and feel more empowered in their lives, always aiming to meet people where they are and help them build a life that works for their brain, not against it. This is a great conversation, and we're excited to share it with you. But before we get started, please make sure you hit that subscribe button so that you always get the new episodes for more real talk about midlife wellness. Before we dive in, just a quick reminder. This episode is for educational purposes only and isn't medical advice. If you're dealing with a health issue, please check in with your healthcare provider.
Hi, welcome to the Nurse Coach Duo. My name is Angie McGuire, and I am the owner and founder of Coach Angie out of Oak Park, Illinois.
And hi, I'm Jen Schroer, the owner of Clarity Health and Wellness Coaching. And today we have Jennifer Ritchie with us today to talk about ADHD testing. And we're super excited, Jennifer, to have you. So thank you so much.
Thanks, guys. I'm excited to be here and to chat with you guys and your team and audience just about this topic.
Yeah, it's become such a popular topic in the midlife realm, the menopause world. We're seeing it all over the social media and hearing it on podcasts. And so we really thought this would be a really great topic to bring to our community because so many of us are having symptoms that we're like, what is this? What is going on? Do I have dementia? Do I have ADHD? Is this just perimenopause? You're kind of going all over the place. So,
Yeah.
yeah, so let's just get right into it. And if you could just tell us a little bit about, how you do your evaluations, what that looks like, and, when a woman in the midlife comes to you, kind of what that looks like.
Yeah. So we've actually had several women in, I would say, the fall, winter present for concerns related to ADHD in their 40s and even 50s with perimenopause as part of that presentation. So it's been really a good topic for me to talk about right now as I've been doing a lot of these in my clinic. So when women come in just in general for ADHD evaluations, there is usually the process is that we start and we do a good intake interview and we talk about what has been going on in their world. I'm usually wanting to get an idea of their symptoms or their challenges that they're facing currently, but also I want to know how long has this been going on? So we're talking about their history in childhood. What was school like for them? How did they do in high school and college? What about their work history, their relationships? So we're covering a lot of different topics to see how long has this been going on and how is it presented in different settings. And so that's the first part of the evaluation process is really just getting a good idea of what this looks like for them. Part two involves more diagnostic testing, where we're giving them cognitive testing, tests that look at executive functioning. So, how well can they plan? How well can they inhibit their impulses and switch between tasks that might be new to them? And then we also have people fill out rating scales to look at things like anxiety, depression, trauma, other types of symptoms that could be contributing to what's going on as well. There's a high rate of other mental health diagnoses that go along with ADHD. And so we want to rule those in or out as well when people come in for that. And so we usually do some follow-up interview during that second phase of testing just to clarify some things. That second phase usually takes several hours for people to do in our clinic. Depends on how well they can focus, how long they can stay seated, and just really trying to make sure for that person individually, we're giving the specific assessments. It's not a set battery. We do have things that we always do, but we typically also give tests that are dependent on that person's unique challenges and history as well.
That's great.
That's kind of, yeah.
So when women in perimenopause and menopause, women in midlife, basically, coming in for ADHD testing, seeking your help, what are the most common complaints, would you say, or challenges that you hear about? And then do you feel like they differ from other age populations, like younger or older?
That's a great question. So many times the women who come in are facing not only some of these like brain fog, cognitive challenges, and memory issues, but they're also facing some difficulties with like emotion regulation. So some anxiety, depression symptoms that are impacting both typically their work life, but also their relationships. And so I would say the main reason that people end up typically calling our office for the assessment is something big has happened at either work or their relationships that they're like, this can't go on anymore. Like I have to figure out what's going on. Like I can't keep doing this and not know what's happening. So those are like the reasons that people end up actually calling, is because of a life event that has really been bothersome for them. I'm just thinking of a couple of women who have recently presented to my clinic. One woman was really particularly bothered by the fact that she would be talking and completely lose her train of thought and not be able to like even halfway remember what she was talking about. And I typically do not see that in younger females to the same degree. I might see it in some level where they get distracted and start talking about something else and just forget, but it's not like forgetting mid-sentence their words and not being able to recall what they were talking about. So that can be a little bit different. I think the memory issues can present similarly, though. Like I forget my phone, I forget my keys, I lose my sunglasses, I can't find the remote. But typically those things have been present for a long time, and they just increase in the severity of how much they're presenting for that person in particular. They do present more with some of those hormonal issues, though, of like, I'm having night sweats, I am way more moody, I am really struggling to manage my emotions more like when I was a teenager than I did in my 20s and 30s and things like that, because they are having so many of those hormonal shifts compared to women who are a bit younger.
Yeah, I think that's definitely like what I'm hearing from the people that I've been working with and that I talk to is it's very much like, these things didn't used to bother me, and now I can't control either my emotions or my concentration. Like I used to be able to do five things at once, and now I can only do one thing at a time. And I've read a lot and heard a lot about how, the lack of or the decrease of estrogen or the craziness, chaos of estrogen in this perimenopause, menopause time frame, it kind of unmasks some of those symptoms. And like you're saying, like people are like, I don't understand like why it's actually getting worse, or suddenly I can't control it. So in your experience, when you are, doing these tests and you're meeting these women, how often are you kind of seeing that, we're actually seeing women being diagnosed with ADHD in midlife for the first time ever? And kind of how often are you seeing that, oh no, this is just hormones? And also, how do you tell a difference?
Yeah, that's a great question. So I think when I'm looking at diagnosing women with ADHD in general, I see a couple of trends and patterns. Women who have gone with undiagnosed ADHD tend to have a lot of masking and compensation strategies. And what I mean by that is that they tend to find ways to get through life. They make themselves a ton of lists. They might seem really put together on the outside in certain areas of their life, like their work or when they're interacting with other people, but then their home life is a complete disaster. Like they're falling behind on basic things, household chores, stuff like that. So those are things that I kind of look at. Like, were they able to function up to a certain point and there was something that changed in their life? They got married, they got a new job that had more responsibilities, they had a baby, they hit perimenopause or menopause, where things just started to crumble. And the reason for that happening is typically because their strategies that they had no longer worked for the severity of their symptoms. And I see this in perimenopause or menopausal women, but it's typically not the first time that it's happened. If we're diagnosing them with ADHD, for example, one of the women I just did, she flunked out of college. She flunked out of college despite having really good grades in high school, because once she lost that structure of high school and was on her own, she couldn't function without the structure that she had previously had. And so she didn't make it through college. So there was a history of her losing that structure and struggling to function. And so what we know about ADHD and estrogen is that estrogen moderates the symptoms of ADHD. So when women have higher levels of estrogen, their ADHD symptoms are not as bad. So women who are actually pregnant do great with their ADHD symptoms. Like, they're not having the same challenges. But when we hit perimenopause and menopause, our ADHD symptoms get worse because that estrogen is dropping. And so that can be a time where I see women start to have a lot more of those challenges, because biologically, the things that help them manage their symptoms are decreasing.
Yeah.
And so it's really, for me, a lot of the women that present to my clinic are very knowledgeable. I think they're well researched and can understand these things. And they're not just going to present for things that I'm not really kind of confident about or seeing patterns with. I think there's only been a couple cases at my clinic where I'm like, oh, nope, this is not ADHD.
That is so interesting. And I'm so glad we're talking about this, because this is what we hear. We hear these stories, the stories that you talked about, the patient that you just saw in the clinic. And it's so interesting to think about. I think we strategize through our life, right? We're teenagers. We have our strategies. Our 20s or whatever. And then, those that have worked don't work anymore. And that's so interesting to sort of normalize it in a way, right? And I mean, that's what Jen and I are trying to do on this, with our interviews that we do, is bring information to women in midlife that most women have not learned. And they're worried about themselves, and they're worried about starting to talk and not being able to finish their sentences. And it's just, I mean, it's interesting to hear how you go about your assessment and your evaluation. When women are diagnosed with ADHD in perimenopause or menopause, and through your evaluation, it's not only to do with hormones, right? It could be a combination, of course, with the loss of estrogen. What lifestyle or non-medication strategies do you typically advise women to manage their symptoms? Especially with the overlapping of the decrease of estrogen and the new diagnosis.
I'm a pretty big advocate in general that life medication is not going to treat all of the symptoms of ADHD. It's just not how it works. And so I try and be very upfront with all of my clients about that. But specifically with women who are struggling with perimenopause and ADHD, we really have to, and I talk about battery life with my clients a lot. What is your battery life? How much energy and effort are you putting into certain things? And so for some of them, it's talking about setting boundaries, thinking about what we're spending our time doing, and really considering, are we saying yes to things that we need to say no to? Do we need to engage help from our community, whether that's a partner, spouse, family members, friends, other health providers, things like that, to really just make our day-to-day lives easier. And sometimes that might be, all right, we're going to use some paper plates and plastic utensils.
Yes.
We're going to order groceries off of Instacart. We're going to do a pickup order, very simple things that can just make their day-to-day life a bit easier. And so those are some of just the basic things that I talk about with women. How much are you trying to do? How much is on your plate? And you have 15 spinning plates that you're trying to keep up in the air. You can't do that anymore. You might have been able to do that in your 20s. Your battery cannot tolerate that anymore, guys. Let's be real. We can't do that. So that is one big thing, from a lifestyle perspective, we really try and talk with them about is hey, what can you handle in this phase of life? It's not a failing, a moral failing, a personal failing, anything like that. It is just the reality of this phase of life that you're in, especially for women who have kids and they're trying to run to sports and, do all of the things. That's just really difficult. The other thing that I really talk with them about is just good health habits, sleep hygiene. Are you moving your body? Are you, eating something that has protein and some fruits and vegetables? Like, you can't just be eating sugar and getting those dopamine hits all the time, guys. That's not going to fuel your body. You're not going to be resting and be able to focus in the ways that you need to. So that's something that I talk with them about. I encourage them to have conversations with some type of health professional about, if I'm really seeing some concerns about like diet, if I think hormones are really a big issue, do we need to see a nutritionist? Do you want to explore some type of like, I don't, hormone replacement? But I usually tell them like, let's start with some of these lifestyle changes and see what that's going to do for you. There's some other like types of interventions when it comes to therapy. I think therapy can be helpful for anyone if they've not done that. Occupational therapy is actually becoming more and more common for women too, to be able to use that as a way to improve some executive functioning skills, learning some time management, things like that. There's a lot of different therapy and lifestyle interventions I'll really have them kind of focus on. And, just talk with them about their preferences for medical interventions and kind of respect that from them and how they want to go, but really explain that those aren't going to be a fix all.
Yeah, I mean, you're speaking our language. Lifestyle changes. We are all about that because, whether you do hormones or not, on either side of it, before it, after it, what have you, you still need the lifestyle changes. We've preached that a million times on this channel, just because so many, like you said, like so many people think that the medications are the end all be all, and it doesn't necessarily clean up everything for you.
I tell my clients it's like getting a little boost. You might get a little boost and it might help you implement some of these skills you're learning, but it's not going to make you focus and not lose things. You have to have the skills to help as well.
Yeah. And I love the way that you talk about it as well, because that is probably one of the things Angie talked a little bit about normalizing, but we have to help women just feel okay to say, I can't do it anymore. Because there is this sense of overwhelm of, you use the words emotional regulation, these types of things, this, all of a sudden everything weighs heavier in perimenopause. And then if we add ADHD on top of it, and now your tactics or your tools that you were using, your coping mechanisms aren't working anymore because of the midlife, it's just like, it's okay to admit that I just can't do the same things anymore. And that's what I usually like. People are always like, am I in perimenopause? Am I in perimenopause? And I'm like, well, are the things you used to do working for you anymore? And that can be in exercise, that can be in diet, that can be in sleep, that can be in coping mechanisms. And when they stop working for you anymore, it's probably a hint, right? Like, I just see that, and then you think you got it, and it changes again, because you start to lose even more of those hormones. So yeah, I think you're right on. Is like how you're describing it is so helpful, and I appreciate that, because I think it'll make so much sense to our audience. Yeah, so I guess, if I'm a woman and I'm like, okay, I know I'm in perimenopause, but man, this AD, I keep seeming to tell people, I think I have ADHD. And, sometimes people throw that around a little too flippantly, but like, I just have always felt that way, or what have you. What would your recommendation be, kind of, if they're thinking this could be something more than just hormones, this could really actually be ADHD, and I think I need to figure this out? Like, what recommendations would you have for them going forward?
I would first off just say start to do your research. Like start to, whether it's listen to podcasts, find a book that you read or listen to, start to kind of, and specific to women in ADHD, there are some really good ones out there that have start to come up. And you can really kind of start to see like, what does this look like? Because I will tell you, nobody taught me, despite being in grad school and around a ton of psychologists, nobody taught me what ADHD looked like in women. I found it out when I was researching this myself and trying to become more educated in the field. And it started clicking for me. I was like, oh my gosh, that's me. That's me. Like, it just explained so many different things in my life. I was like, oh, that makes sense now. And so I think if they can start to educate themselves and read a little bit more, or, listen to some things about ADHD, and they start to be like, oh, yeah, that is right on the money, then it might be worth seeking out a professional who specializes in ADHD in women, in neurodivergence in women. I would tell people not to just think like, I'm going to go to my primary care doctor and it's going to be solved.
Right.
I've heard horror stories of women who go to their primary care doctor and get dismissed, or go to a therapist or a psychologist who doesn't specialize in this and get dismissed, which is
Mm.
so discouraging for me. But it's the reality is that like people don't get trained specifically in what these conditions look like in
Right.
women. And then additionally, how does perimenopause or how do hormones impact these things? So if that's something that where they're like, yeah, this is me, I really want to dive deep, find a specialist who does this. Don't just go to somebody who you would go to when you have normal aches and pains or a sinus infection or something like that.
Yeah. Is there a way, or you have a website? I know you have a website, but as far as like in nationally, do you have a list of like psychologists that specialize in ADHD? Where can someone find that
Yeah,
who's listening today?
I'm pretty sure, and I can dig this up for this
Okay.
and send you guys a link, but there are some websites where ADHD coaches are certified and they can list some more of their specialty areas. You can, on Psychology Today, filter for people who specialize in like
Okay.
ADHD or autism. Um, and it might even be worth, if you're reaching out to clinicians, asking some questions and kind of talking with them. How often do you work with this population? What do you know about it? And talking with providers, because you'll also get a sense of like if you click with them and if you feel like they know kind of a little bit more, again, you can experience like, okay, they get me, they click with me a little bit more. And so that's okay to do that as well as you're searching for a provider, and not just take the first person who comes through the door. It takes a little bit more effort, which can be very difficult for women who have executive
Mhm.
functioning challenges. And so my kind of caveat there is like, give yourself grace. Don't make
Mm.
this something that you have to like immediately get done. So many of us with ADHD want that like instant gratification. We want to do it right away. Make a list for yourself, kind of slowly go down the list, give yourself permission to take some time on this and find the person that's right for you, because that will make a huge difference in the long run.
Yeah. Well, and I find, I mean, like we're talking about kind of the coaches and stuff, but I find that the women, obviously we were talking about how sometimes you can go to the wrong people first, or it could, not even the wrong, they just don't, they dismiss it. And, women in the midlife, they tend to go to a solid like 8 or 10 doctors before they get any answers. And I'm noticing this trend of they really want a diagnosis, right? They want to hear, I want a stamp of a diagnosis so that I know that I'm, partly so you're not crazy, because that's how you feel. But there's just something in having a way to label it that helps. So, yes, you could, and going to Psychology Today, I think it's awesome finding somebody who specializes in ADHD, but how do they, find someone like you that's doing the testing so they can actually get that, kind of that diagnosis? Is there, again, kind of a national way to find someone, or is it luck of the draw?
Unfortunately, there's not. There
Really?
are not many of us who specialize in this. I think I am one of a handful of providers in the St. Louis area that specializes in, I'm going to even go as broad as like adult ADHD.
Okay.
Mhm.
I have even niched down even further into women with ADHD and who are autistic. So my niche is even more specific. So there is just not a very good system for us to find. If you can, my experience in the neurodivergent community is that if you can find a provider, they have a community of people who
Got
they
you.
know. I have tons of therapists who work with neurodivergent clients, and they refer to me all the time because
Hmm.
people do want that
Yeah.
diagnosis. They do want that. And I tell people all the time, it's not about necessarily a label or a diagnosis. It's about kind of what you were saying, Jen. Like it is this validation, this
Yes.
understanding of what they are experiencing so that they can start to make sense of things that are happening and
Yes.
feel like this is normal.
Yeah.
It's very similar to when people are seeking out the information or to have the validation that they're in perimenopause or
Yeah.
they're in menopause without, I think we know a lot more, even in the last year. I feel like people know a lot more, have more information. But I think a common thread of what you're saying too is what Jen and I, talk to our clients about is just advocacy, being your own advocate. And like you said, Jennifer, like doing your research, bringing that research and have that shared discussion, with your provider. And it's just really, I think, I don't know what it is about Gen Xers, especially. We're not used to walking into our providers with information.
Yeah.
We're like, all right, what do I do? What do I do? And I don't know. I think that's going to change. And it's not to be unprofessional. It's not to be disrespectful to that provider, but I do think providers want their patients to be informed too, and they're seeking help because they have this information. Um, anyway, so I just think like that's just so important to come with the information and find out more from the expert.
I 100% agree with that. I've had some of my younger clients who've been seeking diagnosis, they will actually come to me with like journals and written pages of information. And some doctors have been they've experienced that doctors have been like that's off-putting for some of those professionals
Yeah.
because they say like, oh, you're just trying to write down information that pushes towards the diagnosis, or, like that's just self-diagnosing. To me, that is their way of advocating for themselves and documenting their experiences. And I find it to be really rich, valuable information when I sit down and read those things. I'm like, oh, and maybe it comes to like challenges with communication or differences in the way they process information. But that's something that I try and be really like when we come to like talking about neuroaffirming care. I love when people come in and they're like, here. But I'm like, oh, this is wonderful. Or if they email me things that they're thinking about, I'm like, yes, let's talk about that. Like it's on your mind, talk to me about it.
Yeah.
And so I absolutely think that that is something crucial. Like document your experiences. Think if you have information, if you can talk to your parents and get information about like, what were you like with a kid? Like, did your teachers complain about you? Were you a kid that got good grades but didn't reach your potential because you were too busy doing other things that interested you more? Like, let's talk about all that stuff because that is such rich information.
Yeah. Yeah. My mom just recently gave us a box of all our old report cards and all this different stuff that we did as a kid. I'm looking through it, I'm like, I thought I was a good student. I'm like, all these teachers are saying I need to pay attention. It's like, and I've like got D's and stuff. I'm like, what happened? My mom's like, you were a good student. I'm like, I'm thinking I have other proof here that tells me I wasn't.
Yeah. Yeah.
Yeah. I love the tracking thing too, because like for me, for anything that when I'm coaching somebody, that's the first step I tell them. And it doesn't have to be like this elaborate journaling thing. It can literally be like, and I don't, you can tell me whether you see this affect women who are still cycling, but and I would think it would, but I always tell them to track around their cycle, right? Because what happens in maybe your first 2 weeks is very different because you have high estrogen, your estrogen is climbing, right? Then your second 2 weeks when your estrogen is falling and your progesterone is falling. So to me, when you're tracking that, that's even better info, even more information to say, you know what, it's on the 15th of every month that I am having whatever, or the 22nd or whatever, so you can say, and then it's also like, how much is it interrupting your lifestyle, right? Like, how much is
Yes.
it impacting you? I think that that's super important information. And where we talk about like advocating for yourself, we've said this before about other things like, but don't take no for an answer, right? If you go in and you feel like something's wrong
100%.
and you walk in and that doctor sends you like, says, I don't want to look at that or anything, then you just find yourself a new doctor. And I get that that can be tasking, horrible and just a lot on you, but you know whether your body should be acting the way it's acting. So yeah, it's very important. I love that we have services like you have because it sounds like it's extremely needed whenever you're like one of the only ones out there.
Yeah, I love doing what I do. And I know that there are some barriers for women to get a diagnosis. But I've when I do feedback with sessions, so after I've done my interview, after I've done all of the testing with women, I sit down for about usually somewhere between 60 to 90 minutes and I go over all of this stuff with them. We talk about
Amazing.
recommendations. We talk about like, I really do a lot of psychoeducation about like, how does your brain work? Why are some of the things that have happened over the course of your life? How does this relate to the diagnoses and how has it impacted your functioning? Like we just spend a lot of time going through, and I have so many women who cry tears of like relief,
Really.
who cry tears of grief of like, I wish I would have known this. It
Mhm.
like, could it have changed how my life was? I can't answer that for you. But what I can tell you is that now you know, and
Hmm.
we can do something different. And we really talk about like, what are the things that you can do moving forward? Because I think ultimately, like, we want to know, but we also want to know what to do next.
Yeah.
Where do I go from here? I have this diagnosis, and now what's next? And so sitting down, that is really the powerful part for me when I do these evaluations is these women like it starts to register and it's like, oh, okay, that makes sense. Like, oh, I could see how that could be helpful. Or yeah, I didn't think about that. I should totally do that. And so it just becomes very empowering for them to have
Mhm.
somebody who's like listened and validated their experience, but also giving them tools that are specific to like their journey and their path. I just really love being able to do that in my job.
Mhm.
That's amazing.
Yeah.
Yeah.
And it sounds like you're really good at it.
Yeah.
And
Well,
I'm so
thanks. I can nerd out and talk about this stuff. I literally have done 2 other speaking events this week. This is my third one, and I've been like loving it because I'm like I'm nerding out on the stuff that I
Right?
like to do.
yeah, you should. You should be really proud of it. It's
Yes.
exciting. And you've given us, so much information today. And I think it's information that women in midlife are looking for. And we thank you. And we you've given us a lot of takeaways. But do you have one more thing you'd like to leave our audience with as we wrap up today?
Yeah, I think Jen mentioned it already, but just like you are the expert in yourself and your body. Do not let somebody take that power away from you.
Absolutely. Love that. Yeah.
Yeah.
Advocate, advocate. Yeah. Thank you
Advocate
so
for
much.
yourself and just keep going because there is a way for things to be different, to be better. So just keep at it. I know it's a journey, but trust your gut.
Yeah. Absolutely. Well, thank you so much, Jennifer. That was a ton of great information. If I will just say, reiterate that if you are feeling like, you're just not, you're a little off, your brain is just not functioning the same way that it used to, really start to look into this. And if you have time, Jennifer, later, if you can send us a couple book recommendations, we can include that in the
Absolutely.
description. Because,
Mhm.
obviously there's probably a bunch of books out there. We want to know just from you, which ones you think are best.
I
Um,
have a list I can send you guys. No problem.
Awesome. Love that. So, can you tell everyone like how they could find you if they are in an area that you could help them and, where you're licensed, I guess, who you can help.
Yeah, so I am located in St. Louis, Missouri, but I am actually licensed through most states in the United States. So if people are interested in doing an eval, we can do them virtually as well. We often see clients virtually and kind of help with those things. They can find our website, which I hope that you guys can just drop those in the comments and
Yes,
links.
of course.
Our Instagram, Facebook, LinkedIn, tons of ways to get in contact with us. And we are one of the things we pride ourselves on is being a responsive mental health office. So many people talk about like they call places and they never get back to them. So if you reach out to us, we will get back in contact with you.
Fantastic.
Um, so thank you guys so much for sharing that. And I will definitely share some recommendations for people, whether it's books, podcasts, websites, things like that, that they can explore.
Perfect.
That's
Awesome.
great.
Yeah. Thank you
Yeah.
so much.
Thank you.
Well,
Thank you
if
guys for having me. It was great.
Yeah, absolutely. This is fantastic. So, thank you so much for joining. And if you like this episode, please make sure you give it a thumbs up, add some comments, and share with friends. We would love to have more subscribers. So, please subscribe and let us know what you think.